And now turn the foam roller so it's longitudinal. And you're going to sit on the very edge of the foam roller and lie back so that your whole spine is connected to the foam roller. Now you're going to do just a little pelvic tilt and a little chin tuck so that you're trying to take the curves out of your spine. Good. Is your head resting on the foam roller? No. So lie back. And now slight chin tuck. Good. And now place your hands down so that your forearms are down on the floor with your palms face up. And then you're going to do like an angel in the snow, trying to bring your arms out to the side until you feel a gentle and comfortable chest stretch. Slightly bend your elbows as you come up so that your forearms stay down on the floor. And you should feel a nice stretch into the pectoralis region. And then once you feel a comfortable stretch, you want to relax your hands. Everything should just rest. And you want to do some deep breathing. Good. So about 3 to 5 deep breaths from your diaphragm. And really try to, you're imagining lengthening your pectoralis region or your chest muscles. Good. And then come back down. And typically on repeated repetitions, you'll be able to go a little bit higher with the same amount of stretch. Now cross your arms over your chest, and that opens up the back portion so your shoulder blades are coming a little more away from your spine. And now you're going to roll from side to side. We call this ironing. You're ironing your muscles of your back right in between the shoulder blades. And it's not a big motion, it's fairly small because there's not a lot of room to move without falling off the foam roller. So you stay nice and balanced using your legs, and generally this feels pretty good too. Yeah, that's it. That looks good. And then there are other things you can do on this. So put your arm straight up toward the ceiling, and now reach and roll at the same time with one arm, and then reach and roll with the other. This is another ironing where you're just trying to protract or reach up, getting that shoulder blade moving, almost getting it out of the way. That's it. Good. That's nice. Good. Okay, and now you can do lower abdominal exercises on this, and we love this because you're above the ground so that it allows for a little bit more range of motion. And you can feel if your pelvis moves because you have that foam roller as a little biofeedback. So you do that pelvic tilt into the foam roller so that you're really straightening out that lumbar curve. And now you bring one leg up toward your chest and then slowly lower, but don't let you can keep your knee bent, and don't let the pelvis go along for the ride. So the pelvis stays down onto the foam roller. That's it. And you're controlling it using your deep abdominal muscles. Beautiful. To progress this, you can start with both legs up and your knees bent at 90 degrees, and then you lower one leg and tap, and then alternate legs. Good. This is more of an advanced transverse abdominis exercise. Good. Okay, one more. You're going to place the foam roller right around your sacrum in a horizontal position. So right in the small of your back. And you're going to lie back so that your whole back is into that bridge position. And now you're going to bring one knee up towards your chest. Hold on to the back of the thigh. And really pull that knee towards your chest as you let your opposite leg straighten out. And this is a great way to stretch your hip flexor on the straight leg side. So point to where you feel that stretching. Could you point? Exactly. So that gets that iliopsoas. It's a great way to stretch. And the foam roller just adds a little bit more range of motion for that hip to drop. Good. And try the other side. It should always be in a comfortable position. So if the foam roller is too high, sometimes it's pushing too much on the low back. Typically, if it's right at the sacrum, it feels a lot more comfortable. That's good. And you hold that for 30 to 45 seconds, doing the deep breathing. If you're very tight in your hip flexor, then typically you can't, it's hard for you to reach the ground. And just like Jessica just did, she bent her knee, and that makes it a little less of an intense stretch. Good. Okay, that's the foam roller series.